Thanks so much, everybody. If we can go ahead and have a seat and get this started. Very, very excited to be here today, and most excited to have our distinguished guests, distinguished panels, and all of you guys who are here to participate in this discussion. To get this show on the road, I want to have John Carson, the President's Director of Public Engagement, address the group. John is a mentor to many of us here in the White House and is an environmental engineer by training. John? Good morning, everyone.
Welcome to the White House, and let me kick things off by thanking the Healthier Hospitals Initiative and all of you for the work you are doing to be leaders in sustainability, leaders in your community all around the country. And Rohan asked me to come up here today to start this morning out with an ask for all of you. Now, we've got a great event planned today. You're going to have a two-way conversation with leaders in the healthcare industry who are leading on sustainability, with administration folks. But my ask of all of you is to help us tell this story. Tell the story of what brought you here today, your connection to sustainability and healthier hospitals, what your institution is doing. Help us tell the story of what inspired you to be a part of this, what you learned today. If you can blog about it, write about it, tell 3 people in the grocery store this weekend, tweet about it. We're going to be using the hashtag Healthier Hospitals. If you don't know what a hashtag is, just send me a tweet and I'll explain it to you. I'm at John Carson 44. And I ask you to help us amplify this and tell this story for 2 different reasons. First of all, I think everyone today, no matter how involved you are in this, everyone today is going to walk away with information you didn't have before you got here. You're going to hear about a best practice that's working in a different part of the country. You might hear about an administration program, a federal program that could be partners with what you're doing. So first and foremost, help us share this information, help us get the word out. But the second reason I want your help in amplifying this and connecting people to what's going on with healthier hospitals is I really think that you can play a leading role in inspiring others to take action. As I think about the community I grew up in, where my mom worked at the hospital in town, hospitals are really, and the healthcare institutions are such a center of communities. And when people see the leading role that you're playing in driving sustainability in your community, they're going to ask themselves, well, why can't I be doing that at my small business? Why can't our schools put solar panels on the roofs? I think you will play such a role in inspiring others to be a part of this and improving both the business case and why this is something we need to build our community. So thank you for everything you're doing. Hashtag Healthier Hospitals, help us spread the word, and I will turn it back to Rohan.
Thanks, John. And to keynote our event today, we couldn't have a better person. Heather Zeichel is the Deputy Assistant to the President for Energy and Climate, and in that role, she coordinates all of the energy and climate policy here at the White House. Heather, so happy to have you.
Thank you for that introduction, and thank you for the opportunity to join you here today. By way of context, I serve as the President's top advisor on energy policy here in the White House. That means I spend a lot of time thinking about how we as an administration can move forward on a number of important energy efficiency initiatives. And I can tell you that's been a priority since day one of this administration, because the President recognizes and views energy efficiency as the easiest and most cost-effective way to reduce our dependence on oil, save American families and businesses money, and reduce pollution. On account of that commitment to efficiency, which comes directly from the President himself, we've made, in many cases, historic progress over the past few years. For example, after 3 decades of inaction, our administration established new fuel efficiency standards that will double the fuel economy of our cars and trucks by 2025 and save drivers over $8,000 at the pump. Thanks to the great work done by the Department of Energy and the Department of Housing and Urban Development, the administration has weatherized north of 1 million homes, which is saving families hundreds of dollars on their energy bills and creating jobs throughout the supply chain. And through the President's Better Buildings Initiative, we're working directly with non-for-profits and private sector companies to increase the efficiency of commercial buildings by 20% by 2020. As part of that initiative, we're pleased to have a number of health-related organizations participating, from Ascension Health to the Cleveland Clinic Foundation, which is one of the largest and busiest medical centers in the world. So all of that represents progress, but I want to spend some time on the real reason we're here today, which is to discuss the tremendous opportunity that energy efficiency presents to the healthcare industry and hospitals in particular. Now, I admit that I'm a little biased in this area. My dad is a doctor, my mom is a hospital administrator, and my brother is a surgeon. So I feel a little bit like the black sheep of the family. And so, you know, as great as it is to have this conversation about what we can do to advance energy efficiency, I think it's equally important to show my family, who's watching back home in Iowa, that there is actually an opportunity for our worlds to collide. And I think everybody is certainly on the same page here when it comes to energy efficiency and the benefits it can bring, not just to the hospital administrators, but to doctors, nurses, and patients as well. Of course, the benefits don't come without a challenge. As you all know, making a hospital more energy efficient is an entirely different undertaking than upgrading a factory or local department store. It's much more complicated because architecture for health is unique. A long list of very specific requirements must be met in order to ensure the safety of patients. For example, you don't want a situation where a person comes in with tuberculosis and puts others at risk because of a poorly designed ventilation system. And even more basic things like the layout of a hospital are critical, since the time it takes from a patient to move from point A to point B is directly connected to health outcomes. Time is everything in a hospital. Meeting these fundamental needs of a hospital is challenging enough, so it's easy to see how layering in energy efficiency as yet another priority can make that equation even tougher. And that's exactly why on this topic, it's critical to give everybody a seat at the table, from the architects to the doctors to the hospital administrators. That's when you end up with the best outcome. And as an administration, we've worked to facilitate those conversations. Through programs like the Hospital Energy Alliance, we brought together the Department of Energy, its national labs, hospital administrator, and other healthcare leaders to promote energy-saving technologies and strategies to share best practices. We also continue to help leverage investment in this area. In fact, just yesterday, the Department of Energy announced a new energy savings performance contract awarded by the Department of Veteran Affairs that will leverage $15 million in private sector investments to improve the energy efficiency of 3 VA facilities in the greater Los Angeles area. We think these investments are critical because once you surmount the challenges of integrating energy efficiency in the healthcare industry, the potential benefits are enormous, both from a business perspective and in terms of the overall mission of the hospitals, which is to help people heal. The business case is pretty straightforward. As all of you know, hospitals are facing escalating energy costs at the very same time that advanced technologies are increasing energy demand. Hospitals, by definition, are energy-intensive facilities that have to operate 24 hours a day, 7 days a week, 365 days a year. Given the amount of energy that hospitals consume, the ability to do it all more efficiently can translate into significant cost savings and a stronger bottom line. Of course, the dollars and cents represent only half the equation. The other half is bringing the best possible care to patients. Now, some question whether hospitals should be making major investments to save energy when they could put those same dollars into medical equipment or more doctors and nurses. From our perspective, investments in energy efficiency and renewable energy complement rather than compete with patient-oriented outcomes. Every dollar not spent on a water bill or a heating bill is a dollar that can be used to invest in life-saving equipment and improved patient care. And as I said earlier, hospitals have to be open all the time. In that regard, greater energy efficiency and on-site renewable power can dramatically increase the hospital's power reliability even during a time of crisis when their services are most needed by the surrounding community. With that, I just want to thank you again for being here today and for all the leadership you're providing in this area, which truthfully we will all benefit from. And if there's one thought I'd like to leave you with as you continue on this event, it'd be this. I challenge you to think about hospitals as a kind of patient. Just as doctors monitor the vitals of their patients, it's worth asking how our building is performing over time. How healthy is it? If it's an older facility, where are the vulnerabilities and risk factors? And if it needs work, what's the most cost-effective action to track progress? I think that kind of analytic approach that is second nature in the medical profession can be creatively applied to improve the health and performance of any hospital building, and in doing so, better serve its patients. Thank you.
Thanks so much, Heather. And to get on with our panel, our moderator for today's first panel is Maria Vargas. Maria is the director of the Better Buildings Challenge, which Heather talked about just a second ago at the Department of Energy. Maria has, as her goal for the Better Buildings Challenge, is to make America's buildings 20% more efficient by 2020. And this leadership initiative involves chief executive officers, university presidents, and state and local leaders that have committed to upgrading buildings across their portfolio and providing the energy savings data and strategies as models for others to follow. Ms. Vargas also serves as Senior Program Advisor in the Office of Energy Efficiency and Renewable Energy at DOE. Previously, Maria was at EPA for 25 years and was the brand manager for Energy Star. Our panelists today, first panelist is Gary Cohen. Gary is president of Healthcare Without Harm. Gary is the co-founder, president, and executive director of Healthcare Without Harm, the international campaign for environmentally responsible healthcare. Healthcare Without Harm is working to prevent disease and illness in society by assisting the healthcare sector in understanding the links between a healthy environment and healthy people, and helping hospitals every day become more environmentally sustainable. They have over 500 member organizations and partners in over 50 countries. He's also the executive director of the Environmental Health Fund, which works on domestic and global chemical safety issues. He was awarded the Skoll Global Award in Social Entrepreneurship in 2006 and the Frank Hatch Award for Enlightened Public Service in 2007. Thanks for joining us, Gary. Second panelist is Jeffrey Thompson, Chief Executive Officer at Gunderson Lutheran Health System. And I know John Carson, proud Wisconsin native, is very, very happy to have you on the panel, Jeff. Dr. Thompson is a Chief Executive Officer and Chairman of the boards at Gunderson Lutheran and is a practicing pediatric intensivist and neonatologist. He's founding member and past board chair of the Wisconsin Collaborative for Healthcare Quality. Presently, he is chairman of the board of the La Crosse Medical Health Science Consortium. The next panelist we have is Jay Knox Singleton. Jay Knox is the CEO of Inova Health System and is one of the nation's most integrated and most wired healthcare delivery systems, one of the largest in the metropolitan Washington region. Throughout Mr. Singleton's stewardship for the past 25 years, Inova Health System has pursued its not-for-profit mission of providing world-class healthcare to all members of its diverse Northern Virginia community, regardless of the ability to pay. During his tenure, he has led Inova through a period of significant growth and expansion that continues today. It now comprises hospitals, nursing homes, emergency and urgent care centers, assisted living communities, a home health agency, community health and wellness programs, and various community clinics. Thanks for joining us, Mr. Singleton. Next is another person that Heather mentioned, or another entity that Heather mentioned, from the Cleveland Clinic, Christina Vernon. Christina is the inaugural director of Cleveland Clinic's Office of Healthy Environment, established in 2007. She is a registered architect with more than 10 years of experience, most of which focused exclusively in healthcare planning and construction. She oversees the sustainability program across the Cleveland Clinic health system, which has nearly 40,000 employees and over 23 million square feet in its portfolio, with sites in Northeast Ohio, Florida, Las Vegas, Canada, and Abu Dhabi. Christina oversees a network of green teams and advises green building projects throughout this $4.6 billion enterprise. And under her leadership, the Cleveland Clinic became the first healthcare provider in the United States to sign on to the United Nations Global Compact and receive 13 national green healthcare awards from Practice Green Health in 2008 and another 13 in 2009. And last but not least, Seema Wadhwa is director of the Healthier Hospitals Initiative. And Seema, I want to just take a quick second to thank you for putting on this event and helping our staff. Without Seema's help and involvement with the Healthier Hospitals Initiatives, this event just wouldn't have taken place. So thank you for your leadership. And Seema is, as I said, the director of the Healthier Hospitals Initiative. It's a national campaign to promote healthcare sustainability, and she also serves as the director of sustainability for Inova Health System. She is responsible for the creation and adoption of sustainable management practices and has worked to align environmental and engineering best practices with business requirements, including cultural and process change throughout the healthcare industry. She also serves as the Director of Sustainability for Urban Limited and is focused on helping organizations reduce their impact on the environment in a business framework. Maria, take it away.
Great. Thanks so much, Rohan. Thank you all for being here today. It's going to be a pleasure. As you could hear, we have a panel of very distinguished experts in the healthcare community. And just to reiterate very quickly why it's so important, you know, the healthcare industry spends about $8 billion on energy a year. Hospitals, as you can imagine, as you know, are very energy intensive. They use almost twice per square foot what an office building does. So the potential to save energy, money, and protect our environment is dramatic. So I'm really hoping that the panelists today sort of give you some new insights into the potential and the opportunities and really the leadership role that they're taking. At the Department of Energy in the Better Buildings Challenge, we really are seeking to profile those organizations, among those seated at the table with me today included, those who are taking action to really drive change and serve as mentors for others in the marketplace. So without further ado, let me go ahead and get started. Actually, there is one more ado. I was asked to remind folks that we are taking questions on Twitter. Rohan told you the hashtag, which I also think is on the screen, is hashtag Healthier Hospitals. So please feel free to submit questions. As many of you hopefully know, because these events have happened before, but just to let you know how it's going to run, for about 40 minutes, we have some questions teed up for the panelists. I'm going to ask them to be fairly brief. Brevity being the soul of wit, but also because I think there's a lot of learning. So we're going to ask the panelists to sort of talk very quickly and succinctly about sort of what it is they've done. And then the last 20 minutes, we're going to take questions from folks either online or in the audience, questions that you've been burning to ask or issues that you think are important to raise that may help others in pursuing greater efficiency within the healthcare industry. So now, without further ado, let me go ahead and just tee up the first question. Each of you has really played a leadership role in transforming your hospitals into a more sustainable healthcare system. And I think the audience would benefit greatly from knowing sort of where that came from, what some of the largest obstacles and solutions that you've seen are, and what really drove you to take these greener practices and make them part of what your organization is doing. So just to shake things up a little, I'm going to ask Gary to go first, if that's all right. If you could just quickly address that, and then we'll go to Christina, and then we'll go down the line, if that's all right.
Well, we would like to create a vision for all of you to hold together. And the vision is of energy-efficient hospitals all across the country that are modeling the transition from polluting fossil fuels to a renewable energy future as a community health and resilience strategy. We ask you to imagine hospitals that are creating healthy food environments and transforming their purchasing to support more sustainable agriculture as a way to address the epidemic of obesity and diabetes in our society. Imagine hospitals that are detoxing the products that we buy and becoming leaders for green chemistry and safer alternatives for our society. Americans now have cancer rates of 1 in 2 for men and 1 in 3 for women. Learning disabilities affect 1 in 6 children. Through the Healthier Hospital Initiative, we're driving the marketplace of $135 billion toward more energy-efficient electronics, toward greener cleaners, toward safer products, toward healthier interiors. Imagine cancer centers without carcinogens. Imagine children's hospitals without chemicals linked to birth defects. This is the vision that is becoming reality through the Healthier Hospital Initiative, by galvanizing the leaders of the sector and by creating a roadmap for hospitals to travel together, to learn from each other, to save money, and to align with the core aim of healthcare going forward, which is improved patient care, better community health, and lower cost. So the obstacles that we've faced have been that there's a very uneven adoption of a lot of these sustainability practices around the country. And by coming together with Healthcare Without Harm, our sister organization, Practice Green Health, and partners like the Center for Health Design and 11 of the largest hospital systems in the country, we've created this initiative, we've created a roadmap, and we're offering this opportunity for free to every hospital in America to embed sustainability and environmental health into their core operating principles.
Great, thanks, Gary. Christina?
In 2007, we began our sustainability journey with a very simple but powerful realization that human and environmental health are connected. And as caregivers dedicated to providing world-class care, this necessarily broadens the lens that we have to apply to looking at the way we operate our facilities. By internalizing that realization, it helped us find opportunities to be more efficient, provide higher quality care, protect patient safety, and protect the health of our caregivers by taking action that is focused on sustainable triple bottom line results. By taking that approach, we have found so many opportunities to do the right thing by our community and with our community, by our caregivers and with our caregivers, and for our patients and with our patients. And this has helped us be a better organization. It's helped us be who we are. And as a world-class healthcare delivery entity, it's incredibly valuable to us to make sure that we're engaging all parts of our system in doing what we can do to be supportive of the patients, not only today's patients, but tomorrow's patients. And not only the caregivers that are working with us today, but those caregivers of the future. And so by looking at the way that we interact with the ecosystem upon which all of those populations rely, we necessarily have to adopt change and have done so. And I'm very pleased that we have this opportunity today to talk about this in a broader context and share the important message that all hospitals have opportunities, big and small, in lots of arenas of their work, to be better stewards of human health, which is their core mission, by supporting the ecosystem that we all rely on.
Great, thank you, Christina. Jeff?
Well, thanks. We agree with the principles that Christina was talking about. We are a much smaller system than Cleveland. We are more like 85% of the healthcare organizations in the country, and I'd like to speak just a minute to the leadership of those organizations. Why would a CEO, a senior administrator, why would a community board member worried about health and their hospital or their clinics dig into this issue? The answer is, it's your mission. Every one of our missions say improve the health and well-being of patients and the community. Becoming more sustainable. Our approach to sustainability says that we have to improve the health of our community, but it's both the physical health and the economic health. We have to do this in a way that saves money. So we believe we can lower the cost of health care. We can decrease the pollution-related health issues. We can inspire our staff. We can have a good return on our investment. We can partner with multiple pieces of our community, and doing this, teach others how to put all this to a package and deliver it to a board and say, what else? What else can you do that delivers so much to your community and to your organization? So we believe we can improve health and improve the economic health of our communities by partners, not with other businesses, not with the communities, but with government agencies, foundations, other folks. So we have a lot of experience, and we'll be happy to share that a little later. But that's, in a nutshell, that's where we're at.
Great, Knox.
I think a lot of times we think about sustainability and health and our mission, and the conversation is all about what is it that we're trying to do, or how are we trying to adopt strategies to help us reach a goal. And I really like your opening question, which is why? Why did you happen to get into this place where you are in terms of getting passionate about this subject and bringing it into your organization and into your community? I think for Inova, it really goes back to our thinking about somewhat of the point that Jeff was making, sort of what is our vision for the future. And what is it about the future of health that Inova really can be a differentiating leader around helping to create? And that thought process with Inova really led to a belief that the future of health is really around two principles. One is sort of shifting from our historical healthcare mission of restoring health after folks are sick. For quality thinkers, it's sort of, we were getting great at scraping the toast after it's burned at breakfast, to really focusing on how do you predict and prevent? How do you not burn the toast in the first place? How do you keep people from getting sick? How do you optimize the health of each individual? And the core notion that's embedded in that new philosophy or that new idea is really this notion of how do you make the system sustainable? How do you make the individual's health sustainable? So many folks don't have a sustainable health status because of what they eat, what their lifestyle is like, their exercise, their work, their relationships. But sustainability from a health point of view is for an individual is core. We know that the organizations that we lead, the healthcare providers today, the health systems, are not in a sustainable place. Economically, they're not sustainable environmentally, they're not sustainable from an organizational purpose point of view. And so if we're going to predict the future and then we're going to change those processes, the core notion of sustainability, how do you become economically sustainable? How do you become environmentally sustainable? How do you become organizationally sustainable? And then so much of our future really lies in the community, and the realization that the future of health predominantly lies outside the walls of our institutions. If we're going to impact health, we're going to impact a lot more than the people that are within our institutions and those maybe who work or even visit us as patients. That really is talking about a sustainable community. So in some ways, this notion of optimizing the health of individuals, optimizing the health of and the sustainability of our organization, and then optimizing the health of the communities that it's our mission to serve, is a different organizing concept. It calls for a different future-oriented prospective culture. It calls for a different mindset with respect to the way we treat the environment, the way we relate to energy, the way we think of our facilities, the way that we engineer the human experience. We think it all comes down to basically education and engagement. Or you can, if you like A's better, it's sort of awareness and access. Or perhaps it's all about the connection between not just knowing better, but being able to do better. As Jeff said, I think healthcare systems that have that point of view are bringing lots of new ways of executing against that new mission, that triple bottom line. So we're happy today to be here, but the why question is, I think we rethought the future of health, and that really inspired this dimension, the sustainability dimension of our vision and our purpose.
Great, thanks, Knox. Seema.
So I think we've heard a lot of compelling reasons as to why this is important. But I think fundamental to all of those reasons, it really comes down to the culture. And the root of being able to make these impacts is developing a culture that is built on sustainability. Even looking at the definition of sustainability, it's something that has the opportunity to withstand on its own over time. And with all of the reasons behind the mission and the employee engagement, that doesn't happen until it's built into the way that you operate and the way that you present yourself. And I think the opportunity is most unique for healthcare systems because oftentimes hospitals are the largest employers in their community. They have many professionals that are very well revered. And looking throughout society and how unsustainable we are currently, hospitals in the healthcare industry, and most specifically the leaders within those organizations, have the opportunity to change what it is that we focus on and how we're able to move forward. Now, in terms of where challenges lie, culture change doesn't happen overnight. It definitely takes time. And understanding the drivers for everybody engaged is so important, because whether you are a CFO who's focused on return on investment, or a CEO who's considering employee engagement, and how do I keep physicians within my organization happy and not moving around, and nurses when we have such a challenge with staffing, it really is one of the things that will help the industry or your organization stand out and be the place to work, because you understand the values of community and understand that you have that role to play. You know, I think looking at it through another lens, through the Healthier Hospitals Initiative, we have, again, this great opportunity, and it really is all about leverage. If we look at just even the 11 sponsoring health systems, that's over $20 billion worth of purchasing power in over 500 hospitals, over 700,000 employees. And just within that group of 11, we have the opportunity to galvanize and move the industry. But again, with that comes challenge. Understanding what are the key measurables, working together to see what are we going to signal to the market and how can we work together. But more importantly, creating this free platform so that we're doing it in a way that is really changing the entire industry. So that's one of the things that's most exciting, is that given the fact that this is about culture change, we are actively working to promote creating this culture of sustainability.
That's great. So I think you've heard from the panelists, and it's fascinating because while they all said similar things, they all had a unique twist on this vision forward, how to charter a path for your organization, and how to really focus on the future and the kind of organization you want to be. And I think what would be great for the panelists to address next would be how you turn that philosophy and vision into real action. And what's also fascinating about these organizations and the people at the panel is they talk not only about the hospitals, but then the community at large. So what I would love each of the panelists to talk about next, for those of you in the room, but also those watching online, if you're a hospital in a community, what would be great is a couple concrete, real examples of things you've done, the benefits they've provided, perhaps how you overcame some obstacles that perhaps stood in the way, because sometimes change is hard, and then sort of the benefits you saw. So maybe something that you're very proud of that you were able to do despite barriers, and sort of suggestions embedded in that about what you would encourage others to do as a beginning, or perhaps a couple steps down the path towards this greater vision of a sustainable hospital, healthcare system, and vital part of the community. So Gary, let's just start. We'll do the same order.
Well, we're really proud of having eliminated the market for mercury-containing medical devices in the United States and Europe, and now moving toward eliminating mercury globally from the healthcare sector. That was something we're happy about. But the thing I wanted to mention is that we worked with the Internal Revenue Service to expand their definition of what community benefit means, so that it could include expenditures by hospitals that support prevention activities in the community, that support environmental health interventions in the community to prevent disease, as Knox was talking about. So, for example, if a hospital sponsors a farmer's market that provides access to healthy foods in the community, that could be considered a community benefit. If a hospital like Children's Hospital in Boston did, does interventions in people's homes to eliminate the asthma triggers that are bringing kids to the emergency room again and again, that's a community benefit. If hospitals like Kaiser Permanente and Inova double the food stamp benefits of their low-income patients to incentivize them to go and buy healthier fruits and vegetables and model healthy eating habits, that's a community benefit. So we're redefining expenditures within healthcare that can reach out beyond the four walls of the hospital and address the environmental health conditions that are contributing to the epidemic of disease in our society. We spend more money than any country on the world on healthcare, and yet the majority of that money is spent on treating chronic disease. And we need to move upstream and start preventing the diseases that are making people sick in the first place.
Christina, some things that have happened in the Cleveland Clinic.
Yeah, so when I think about what some of our proudest prouds are in our sustainability journey, They come in a couple different shapes and forms. So there's exciting work that we've been able to do that has had big impact on our waste profile and our energy profile. We've saved about $24 million in energy and reduced our energy intensity by 25% since our baseline year of 2008, which is fantastic and has earned us great recognition in Energy Star Partner of the Year in 2011 and 2012. We've also hosted farmers markets across the organization and worked on access. We've made great strides in waste. When we started our journey, in 2007, we had a recycling rate of less than 10%, which is what I think most hospitals who haven't begun this journey will find that their results are in that range. And we're up above 30% and have saved about $2 million in the meantime and brought in $200,000 worth of revenue. That's a great story. But what I think I'm impressed with is that if you talk with any of the leaders in our organization that have been engaged in the sustainability journey, we don't talk about it as a financial journey. We talk about this as a journey that's part of our patients first mission. And with such a compelling financial story, you'd think that we would be focused more on that side, but really what we talk about is improving reliability. We talk about engaging with our community. We talk about how we're reducing chemical exposure for our workforce and our patients. All of those financial savings are really inspired and driven by the sustainability mission, which is fantastic. And keeping that focus on what's right for the patient will help us in the next generation of healthcare, really focusing on how we can continue to deliver world-class, quality, safe care, but by doing so in such a way that we reduce the negative implications of operating our business. And oh, by the way, it's also a great financial story. And I think that's really compelling. But last evening when we were planning for this panel, somebody asked me a very good question that was kind of just a tweak on that. It just said sort of, what's your personal proudest proud? You know, what are you most proud of? And we've been very engaged with the community since the beginning of our journey, and we've been working with the Greater University Circle Initiative, led by the Cleveland Foundation and infused with some significant contribution from the Living Cities Foundation recently. But by thinking of ourselves as an anchor in the neighborhood that our main campus is located, it's helped us do amazing things. Together with competitors, with suppliers, with the nearby university, the community, the city, all together, we've been able to create a new forum that's given us new tools for dialogue, new tools to talk about re-regionalizing our supply chain, new tools to talk about how we can support our community more directly. And out of that has been born the Evergreen Cooperatives, which have been very exciting work for us. And new jobs are being created, not just new jobs, but new jobs that are designed to support the anchor institutions that are employee-owned and generating community wealth in a whole new way. And that is my proudest proud. I know that the work that we're doing in our community is going to support not only this generation, but the next. And as we stabilize neighborhoods and support economic health, we're supporting community health. And that's a big part of this puzzle that rounds the picture out and talks about how it's not just what happens within our walls, it's what happens outside of our walls, and helps us prepare for the next generation of healthcare, which is going to be a different landscape for all of us.
I'd like to keep going on Christina's theme of inspiring the community and leading the community. It's a huge opportunity in many communities. The healthcare organizations are one of the largest employers, certainly one of the more significant contributors to a variety of functions in the community. By showing the way, by partnering with your community, you can really multiply your effect. So we did an internal project. We spent $2 million on conservation measures. It saves us $1 million a year. Math's pretty easy there. Even for us pediatricians, we figure this out. So you can say to a board, this is a great return. And then when I stand up and speak in the community, I can say, this isn't about just, tree huggers from the 60s. This isn't a project. This is a long-term approach to how we're going to live better together as a community. And then that has other folks in the community wanting to work with you. We set a goal to, by 2014, to have all of our energy use offset by renewables. It's a big goal. It's a hard goal to hit. By this time next year, we should be at 80% of that. So we haven't quite got there. We're not even sure exactly how we're going to finish it off. But 80% towards that goal is pretty impressive. Well, how did we get there? Well, it's that conservation move in the beginning. 20% came from conservation, so we teach that to the rest of the community. We look in the community for partners. A landfill in the community. A landfill in the community that had just methane wasted going into the atmosphere. We worked with the county board. They're all worried about money, this and that. We've now taken wasted methane. The county gets over $100,000 in payment for their methane from all your junk. It's piped to our northern campus, has 1,200 people on that campus, that is completely heated, powered, cooled by wasted methane. The county makes $150,000 a year. Gunderson saves $300,000 or $400,000 a year. Very short payback period. An outstanding project. We got some help from the state. We got it organized. We worked with multiple partners. It worked out well. The little town of Cashton, Wisconsin. You want to see a community excited? Little rural communities across the country are wondering how they're going to survive. This rural community, a partnership between Gunderson and Organic Valley, largest co-op of organic farms in the country, built 2 wind turbines. They're pretty big. Got to climb to the top of one of them. It's great, up at 360 feet above the air. And it looks over this community. The whole community turned out because they're so proud that their community, through a substation right there, is going to be powered by the wind. Out of thin air, they get their power. It's a partnership between business, some help from the government, some big investment from Gunderson and Organic Valley, and it results in a community that's very excited. The same way with our approach to food. Knox has done great stuff with food. We've worked with the community, with the schools to change their approach. We've worked with restaurants, convenience stores. Now even the baseball park has nutritionally sound, locally sourced, calorie-bounded food options. Now, that isn't somebody can still come in and buy 8 of them and push past 500, but our 500 Club has spread out, and it's a more thoughtful approach to this. How do you source the food locally? You help a small other rural community who had a great deal of insight build a food cooperative. Pools the food so large organizations like us can contract for it and buy locally what before we had to have shipped in. So our opportunity, not only to better our environmental footprint, but to inspire our communities, little kids, seniors, doesn't matter. They will be inspired. That is part of our responsibility and our goal for down the road, just like Christina said. We have to take care of this generation and the next.
Knox.
I guess I would pick up on Jeff's point in terms of talking about ANOVA's focus. I think our focus, and to some degree our pride in terms of what we've seen in terms of the change we've been able to facilitate, really driven off of 2 things. One is the power of leverage that Seema talked about earlier, and I think Jeff and Christina spoke to. The power that we have, often as the largest employer, the largest energy consumer, the largest economic impact, the principal economic source of vitality in the community. If we have the opportunity to leverage that, I think Inova's focus has been on how do we leverage that position through often our employees or through other connections in the community to sort of outplay our size and even outplay the potential that we have by linkage through others. And I think our principal focus really has been on this notion of how do you build awareness, which is sometimes done by role modeling and being visible, and by simply talking about this is an important issue. But a lot of times the engagement we focus on really is we have to start the engagement with our own. In Inova's case, we got 15,000 employees, another 5,000 doctors and volunteers and other folks that are associated with our institution. So we got 15 or 20,000 people that if we can engage them and we can start impacting the culture of the way they think about health, the way they think of the role of sustainability in the mission of health, and predicting the future, mitigating risk, and improving healthy behaviors, then you've got 20,000 people suddenly who are doing 20,000 times whatever Seema or I can do on any given day. Maybe I take that back. Seema is so productive, it's probably 10,000. But the point being that how do you engage your 20,000 family members? In our case, we think of them as family members. And so a lot of focus in ours is in Inova is trying to build that culture and engage folks. Things like we talked about the Blue Wrap fashion show. We are sponsoring, for those of you not familiar with Blue Wrap, it's the packing material that's used in operating rooms, and we produce mounds of this stuff as waste. Well, we've done everything from sort of work with groups to engage folks in re-sewing and making usable items out of excess Blue Wrap. But employees, we're having a fashion show to build the awareness and engage employees. Now, they'll remain nameless, but certain people really look great in these blue fashions that come out of this. But it's more about engagement. On Friday, I've been guaranteed that I will at least place in the Inova Food Olympics because we're going to have all employees throughout the system. Each operating unit comes and builds basically a competition where it's sustainable, local food that is also healthy from a dietary point of view. And then we have employees compete, and it all works its way up to the final system-wide competition. It's going to be interesting to see how my vegan shepherd's pie does against the other entries, which I'm not very optimistic unless we can find a way to kind of count the votes the way they do in North Korea. But the point being that if you can engage, if awareness isn't enough, if you don't have engagement is the currency of culture change. And for us, whether it's in the community with farmers markets and matching programs to engage low-income food stamp recipients so that they can afford, not only that, knowing that healthy food is great, but if they can't afford to buy it, having the farmers market doesn't help at all. They have awareness, but they don't have access to actionable behavior. So it's all about a culture of thinking through how do you engage folks, change the culture, and from that will grow a whole set of behaviors that frankly you couldn't invent or conceive in advance. So I think I'm proudest of that sort of strategy of engagement and culture change in terms of our efforts.
For me, I think what drives me really varies on scale. I think some of the moments that I've been most inspired and feel so happy and proud to be doing this work is when employees or people who are personally affected by the programming reach out. So whether that is a pilot shuttle that goes into the community to pick up employees and getting email responses about how that's actually impacting their daily lives, or employees talking about how they learn to recycle at work and it's actually impacted what they do at home. That really drives me to know that every little bit is actually making a difference, and this is something that's real. Going on to the next scale, to actually see and engage within an organization's leadership and help them understand that this is not about hugging trees, that this is one of the key roles they play, and then to have that be built into the system with executive compensation tied to environmental sustainability. For me, that was just such an indicator that this work was really being built into the values and the strategic plans of an organization, and that this really is a cost reduction strategy as much as it is about the why of patient care and about community building. And then taking it up one more level to really get the attention of mainstream media, and actually the honor to be here as well, that people realize that this is such an important issue nationally, regardless of whether you have a belief or values towards environmental sustainability. It may be because this is a cost savings mechanism, or because it's about your health and the health of your community. But just the fact that people are realizing that this is the way that we will need to really move forward within our health systems to be more sustainable. Just looking at all of those different scales makes me very proud of what I do every day.
That's great. I wrote down Knox's statement. I think I'm going to put it on the wall of my office. Engagement is the currency of culture change. I really think that's very true, and you've all talked about that. But what we also know is that humans don't like to change. So what I would love, and I'm just going to throw this open to the panel, is there had to be somebody, some part of your community, some part of your supply chain, vendors, who were hard to convince to change. What I'd love to have, because I really am trying to think about takeaways that people can go back and learn from you, was there someone that was hard to convince, and how did you ultimately convince either them or their organization or that part of your community to really drive change to do exactly what you said, Knox, which is to engage them to begin that path towards sustainable behavior and culture change? So I'm just going to throw that open, just shaking it up a little bit here. Just going to throw that open. Was there someone, and I appreciate very much the role that your organizations play in the community. You are powerful players in the community, so that helps you. But I've got to be convinced that you're here because this has been sometimes, not always, an easy path. So if there's a story or an anecdote, or maybe it has been easy, but I would love if someone on the panel would address that.
It's actually been very easy.
It has?
Everything
okay,
just moves. No.
That's great.
There are.
I'll switch jobs with you.
I think when you're pushing out on the edge, I think the hardest problem is not actually solving the problem, but to get people to believe you can solve the problem. So we said we have to reduce our construction waste from renovations or new construction. So we have to set a target. We're going to say 85%. 85% of our has to be recycled. We cannot go to the landfills. And they said, oh, we can't do that because, the construction companies, blah. I said, no. These guys are smart people. They run good companies. They can do, I'm sure they can do this. I had no idea if they could do it. And what are we doing? We're building a replacement hospital now. 98% of the construction material is recycled or reused. 2% goes to the landfill. 5 years ago, it was probably 50-50. Part of the solution was just to believe it could be better, challenge them to get better and better, and measure it. We did the same thing in building the new hospital. We said, we want to use the new hospital, replacing very old, very energy intense, very inefficient for staff space, with much more efficient for staff, for patients, and for our facilities group space. So we challenged the architect. The standard hospital in the country spends heating, cooling, $250, $260 KBTUs, which is just a measurement, you don't need to really know that. We said we have to be far better than that. And they said, like 200. I said, no, like 100. And they said, oh, you can't do that. I said, some place in Europe doing it for 80. And they said, ah, they have different rules. I said, okay, I'll give you a break. 115. That's it. I said, we can't do it. No, it's all intensive stuff, ICUs and all emergency departments. You can't. I said, no, I'm sure you can. I'm sure you're really smart guys. You'll do great. Right now, it's in process. The building's being built. They've got it down to 120. They're hoping to pull out another 5 as they re-engineer and move in. People have to believe we can get from where we're at. Then you have to have the discipline to say, make a plan, measure it, redo your plan, measure it, and stay at it. But the belief that we can do things better, and fundamental to that is the underlying principle that we are responsible to do better. It is our responsibility to do better. If you're going to lead, if you're going to sit on a board, if you're going to be a CEO, if you're going to be a community leader, it's your responsibility to do better. And that's what helps drive us forward.
Great.
You know, Maria, I think I would answer that by saying it's an ongoing journey. So in terms of, you know, what was the biggest challenge, I think it's a constant challenge in terms of getting buy-in from different individuals. But I think what keeps things moving is understanding that it is a journey and that you may be faced with challenges, but having some early wins to help set the tone. I think the way that we're best able to overcome getting anybody on board is really creating a framework to understand what drives a person to do what it is they do, and making this part of their existing priorities rather than saying you have one more thing you need to do. So really understanding how does this help what you're trying to do already, and then, you know, helping position it in a way that it's achievable for them to do it within that framework.
I have an example. Healthcare Without Harm was working to identify the fact that the majority of the market for IV systems were made of PVC plastic, and then to make the PVC pliable, they used a chemical that was a reproductive toxin, and it was being infused into patients. And so we said, look, especially for vulnerable populations, for pregnant women, for babies in a neonatal intensive care unit, we should not be infusing patients with a reproductive toxin. We're learning about that low-dose exposures at critical windows of development can have long-term health impacts. So we brought that new science to the manufacturers, to the healthcare systems, and it really wasn't until we were able to use the purchasing power of large hospital systems like Kaiser Permanente and Dignity Health that said, we understand that science, our mission is to provide the best care for our patients, we're going to drive the market to safer plastics. And because of their purchasing power and their mission, they were able to move the marketplace away from PVC plastics and these phthalates leaching out of them towards safer plastics. And I think that the larger story is that if we're going to get off our addiction to fossil fuels and toxic chemicals as a society, the role of the healthcare sector as 18% of the entire economy going up to 22, 23% of the entire economy is absolutely critical. Healthcare can be the driver for the transformation toward green chemistry, toward renewable energy, toward sustainable agriculture, toward healthier communities. That's the larger message here. It's the pivotal sector of the economy, and not just here, but globally. So that in addition to the national campaign that Seema was talking about, the Healthier Hospital Initiative, we're creating a global network called the Global Green and Healthy Hospitals Network, which includes this initiative in the US, but there's systems in England, in Indonesia, in Thailand, in Mexico, in China, in Australia, are all wanting to share best practices and learn together on the path to sustainability. So this is beyond a domestic movement. This is a global movement for sustainability.
Great. Yeah, no.
it's inspiring to me to be able to hear Jeff and Gary and Christina talk about their commitment to this, and I've heaved a big sigh of relief when invited to talk about what was your biggest barrier, your biggest problem, that Seema didn't talk about me.
Good job, Seema. There you go. Or job security.
That I'll get it later, I'm sure. The point being that I'm convinced that this is that in healthcare, most healthcare leaders, it's the POGO principle at work. You know, the POGO principle: we have met the enemy and he is us. When you really look at what's the biggest barrier to greater engagement and more assertive, creative leadership, it's surprised the leaders. And when you said you were happy to have distinguished guests, I thought you said extinguished guests.
Yes, sure.
Because to some degree, a lot of the folks who are leading today have basically led through a career where the defining mission has been an inward mission. The defining mission has been a restoration mission, not a prevention mission. It's been about acute care, not chronic disease. It's been about curing, scraping the toast, not keeping it from getting burned. And the culture that's been built around that, leaders are culture drivers at their most fundamental. And the more senior, experienced leaders, the more usually they impact that culture. So I'm convinced that the biggest barrier that I face in many respects is me, because having to relearn and sort of reconceptualize how a leader leads in this milieu and how you drive a culture in this milieu. The thing that biggest challenge, what is it Gandhi said about you have to be the change that you want to see? Well, leaders at some level have to become the change that they're trying to drive behaviorally into the organization. They have to become mentally the mindset and the philosophical association with both the problem and the problem-solving process and the solution. I think that that's why I say I admire when you see a leader who thoroughly gets this and lives it, has been committed to it. Today, that's very, very difficult. I mean, this is kind of the old pets, new tricks drill. I mean, and it's almost independent of age, but it is the biggest challenge, I believe. The biggest barrier is current leaders and how they think. And we have to change how we think, and we have to change how we conceptualize leadership.
I think that underscores beautifully the importance of engaged leadership. I mean, I think that it's just to really hit home the fact that at our hospitals and the hospitals that are participating at this level, I think one of the biggest differentiators is that engaged leadership, having the leadership be part of the dialogue, setting the tone, leading the organization in the direction, and I think maybe even most importantly, encouraging creativity in leaders. It's all about creating the space for people to think in a more open way about the challenges they face. We spend a lot of time working with leaders who have, whose particular area of expertise has an opportunity to try to find how it aligns. And then we make sure we celebrate it. We make sure that we give the recognition where it's due. And that's another way we've been able to move mountains in terms of engagement is making sure that we're recognizing the individuals who have changed, who have made a difference. A great example I often share is once we share our sustainability mission, it's unbelievable what comes back to us. The level of engagement we get out of people at all levels of the organization really understanding this and then applying it to their own work is amazing. So we have a police force at our hospital. We have a group of individuals who are charged with keeping our campus safe and secure. And they do weapon training. And once they heard about, we were talking about toxicity and we were talking about chemicals and mercury and PVC and all of the things we were working on, they started wondering what are in the bullets we use. and changed the bullets they use at their practice range because they found they had lead in them. I mean, the amazing things that people do when you give them sort of license to influence their own lives and think about how this applies to their own sphere of influence. Similarly, our fleet manager, who was one of those tougher ones to bring on board, but once he's on board, he was on board and is setting his own aggressive fuel conservation goals and has got his bus drivers so excited about reducing emissions that his bus drivers came to him with a proposal that saved us $45,000 a year on fuel just by changing the way we start our buses in the morning. They said, hey, what if we did this? So by not only engaging leadership who has, let's say, the power of control over a particular system, but also engaging frontline workers and empowering them with enough information that they can apply this to their own space and have significant wins in lots of small ways. And at the scales that our organizations are within our community, regardless of what the size of the hospital or community is, hospitals are a big entity. And so small changes in big entities can make a big difference. So we have to think about how we engage the full spectrum of individuals, from leadership to frontline, so we can get the creativity going at all levels, and we can start to find those new solutions, because we're going to have to design our way out of our challenges and move towards a health-based system, a wellness-based system. And we need every talented mind we've got. We need everybody on the case.
Great. Well, thank you all. And I want to leave time for Seema at the end to talk just a little bit about HHI. But I now want to, in the remaining minutes we have, to throw open the floor to you, folks in the audience or online, to see if there are questions you have for either all the panelists or a particular panelist. So I know there's been a lot said today, and I was curious if there are questions from folks in the room. Don't be shy. Yes.
Just have a question for Jeff and Knox. You know, you get it, your leaders that get it. A lot of the hospitals that we work with are challenged in trying to convince their own leadership. Do you know, how do leaders best receive information from other leaders within the organization?
Go ahead.
Okay, I got it. I think in talking with leadership, whether it's the CEOs, the senior administrators, the boards, the medical leads, you can't assume that they all are going to respond to any one thing. So when I work with groups, I try and work on several different levels. I try and connect with them on, it's consistent with your mission of keeping your community healthy. And that the approach is just an extension of our quality work that we've been working on so hard. It is an extension of that. Some will be more interested in the fact that you can develop a good return on the investment, that it's a financial piece. And I lead with our $2 million we spent on conservation saves us $1 million a year. And I say that several times. And then they get it, that's a better investment that they have in whatever equities or bonds they have their savings in. It is a great investment. And then I talk about staff engagement and community engagement. More and more hospitals, health systems are understanding that they have to be engaged in their community and how easy it is, how 1/3 of all the college students coming out now have environmental issues a part of their value set. It's not a hobby. It's part of their value set. So you want the brightest and the best in the next generation? Develop yourself into a different organization for the future rather than the past. So I try and go after it in multiple levels because no one approach is going to connect with everyone. The whole portfolio of positive effects, though, result in making it a very convincing argument, and an argument that, as Seema and Gary has said, is convincing more and more health institutions. The early adopters are distinguishing themselves. The others are coming along and reaping the benefits. So I think we do have some good momentum started. Question?
We're going to let Knox answer this too. How do you convince you, Knox?
I don't think I can improve on Jeff's answer because I think there are two. It has to basically respond to the value system of whoever you're talking to. If it is the CFO and you can't talk about cost and return on investment, you're probably wasting your time. If you can't talk about the impact on clinical quality or the patient experience to the nurses and the physicians and safety, again, that's their agenda. For a community volunteer who's in the governing position, talking about community engagement, healthy communities, that's what they're going to resonate with. I think a lot of, we talk in terms of there's sort of the different pillars or dimensions of the organization, whether it's people, quality, cost, safety, growth, et cetera. You can relate sustainability strategy to each of those, and there's a real good argument can be made that it does build a great employment brand, it does reduce turnover, it does raise employee engagement, it does raise physician engagement, improves quality, safety, outcomes, length of stay. I mean, go right down the line. The difficulty, I think, is the collateral difficulty, though, is that often it's not an issue of is it valuable. The issue is it valuable enough in comparison to all the other demands that I have for my resources, for my time, for my mind share, to really bring it from somewhere on the list to the top of the list and actually do something with it, or at least high enough in the priority order to take action. I think that's the bigger challenge. It's the what I would call the portfolio issue of how do we get sustainability into the system-wide or organization-wide portfolio priorities, because you can sell its process contribution to sort of all the pieces. The difficulty is if it only languishes down here, the point that Christina was making, you can't sort of bottom up this through the organization. I suspect your questions premised a bit on how do I get the attention of the senior leaders, and that often is I think the biggest challenge. And that's sometimes the hardest sale. But I do believe that is probably the most important sale. In many respects, it is a gestalt of all those, if it can contribute to all those things. There aren't really many horizontal strategies. You think about IT or capital acquisition or allocation that contribute so powerfully to so many of the vertical growth and success drivers of the organization. I think that's probably the most powerful argument, but you have to make a global argument, just like Jeff was saying, because you could appeal to each piece and never get home with the executive leaders because they don't see the gestalt or the power of the whole thing.
Yeah, one more question? Yes, another question?
My name is Kathy Johnson. I'm with Physicians for Social Responsibility. I'm pretty surprised and slightly dismayed that there has been no discussion of climate change in this discussion about sustainability. And, I totally agree with the woman who just spoke about getting to important decision makers in these hospital systems to outline how important it is
Well, Christina wants.
The science of climate change is sufficiently compelling to be identified as a public health and a business risk. And because of that, we're able to talk about it in a sophisticated way as a strategic pressure on the organization and on the communities we serve. But I know that when we did our initial assessment, our Scope 1, Scope 2 emissions, over 80% of our emissions were from our electricity consumption and natural gas consumption. So energy emerged as the number 1 issue. So climate, our concern for climate, and our entire initiative was born out of a concern for climate, what really drives that sort of flagship program. And we became an Energy Star partner right out of the box, really focused on how we can reduce our contribution, because energy was really where it was at for us. So when we talk about climate, we do talk about climate, and we talk about our energy efficiency program as a public health issue today, a public health issue in the future. It is a financial issue today, but it is also our single biggest contribution to climate. So we weave it in, and as was talked about earlier, there's a whole host of ways that we connect with individuals. And we want to make sure we're addressing all of those connection points. So I don't think it was a deliberate omission on our part not to talk about it today, but rather I believe it's generally interwoven with what we're doing as healthcare entities.
I would also add that I think that we're part of this is the part of a beginning of a broader conversation about reframing climate change to be about health, about public health. And that the more that the public understands that our reliance on fossil fuels means more asthma, it means more infectious disease, it means more heat stroke, it means more hospital room visits, and the more that we can internalize those costs and to show how if we can make the transition to more energy efficiency and renewable energy, it's going to actually reduce healthcare costs, it's going to make more resilient communities, we're going to be more prepared for the kind of extreme weather events that we're all seeing. The more that we reframe climate change to be about people and their health and their communities, the more we're going to get a strong endorsement for the kind of actions we all need to take to make the planet more inhabitable.
Okay, we're going to have one more question, and then I just wanted to allow Seema to just talk a little bit about the Healthier Hospitals Initiative. Yes, go ahead.
I'm at the sessions with the Health and Environmental Commissioner. Thank you all so much for an incredibly inspiring and encouraging presentation. Following up on Gary's last comment, earlier this week I heard a presentation from folks at the National Renewable Energy Lab who looked at what it would take to get the U.S. By 2050 to using 80% of U.S. electricity from renewable sources. And they basically said it's technically doable with the technologies we have now. And they cited co-benefits in terms of reducing water use and kind of modest use of land. What they didn't talk about was public health. And I asked the presenters if they had looked at the public health costs and benefits of shifting from the current energy use to this much dependence on renewables. And they said that would be kind of hard to do. And so I wondered if there's kind of some low-hanging fruit opportunity for the healthcare sector to step up and help make that case to say, there are additional considerations that might lead to convergence of interests to make that possible.
I think we are able to do that. There are calculations. We've looked at that ourselves. When we get to 100% renewables, we will take 100 million pounds of CO2 that are being put in the atmosphere a couple years ago down to nothing for our contribution. 500,000 pounds of particulate matter that contribute to asthma and respiratory problems. This brings us back to it's about taking care of your community. La Crosse will be better off, our region will be better off because we do this, and our partners at the county, at the other businesses will be better off. It can be measured, it shouldn't be ignored. It's exactly where Gary's going with it. This is our responsibility to take this on, and you really can't look the other way anymore. We have to say, if we are making these pledges to our community, we have to follow through on it.
Great. And Seema, I just wanted to give you a chance to talk about the Healthier Hospitals Initiative very quickly, and you've seen the growth, and where do you see it going?
Absolutely. So, we heard a lot about different initiatives that are going on and a lot of different successes, and a little bit about what the Healthier Hospitals Initiative is. I really wanted to make a point to leave with a call for action. If you look at the opportunity for scalability and growth and leverage, what the Healthier Hospitals Initiative really does is take best practices from hospitals and health systems that have already had successes and have a platform where we have case studies, webinars, inspirational stories, forums, how-to guides, all of these resources for free so that we can work together and really leverage what we've been doing individually. So I really implore everybody to check out the Healthier Hospitals website, healthierhospitals.org, and use this opportunity to get leadership engaged. Or if you are a leader, look at the case studies of CEOs within the Healthier Hospitals Initiative that have understood why this is important to them and what they're doing so that we can all work together to make our health system more sustainable and really help understand why you should care and what it means to you. So
Great.
hopefully everybody will take that opportunity.
Great, thanks so much. So if, thank you very much. If you will all just join me in giving a round of applause to today's panelists, that would be great.